Hello, I'm Chao Kai-su from National Cheng Kung University in Tainan, Taiwan. First of all, I would like to appreciate the organizing committee for inviting me to give the presentation. I'm sorry that I won't be able to give the presentation in this afternoon. Therefore, I'm going to have a short introduction of genetic diagnosis and treatment of EB in Taiwan here. In Taiwan, the history of EB starts by the first diagnosis of EB by electron microscopy by Professor Julia Lee, and followed by the genetic study by Dr. Cho. She is currently the president of Taiwan Dermatology Association. In 2020, we established the first EB clinics in Taiwan, which is located in the southern part of Taiwan. I would like to focus on the diagnosis and treatment in this talk. About the diagnosis, as we know that the clinical manifestation of EB is quite diverse, including blister, prurigo, muscle weakness, fibrosis, skin cancer, hair loss, and so on. Also, EB is caused by the mutations involved in at least 21 genes. Thanks a lot for Dr. Wei Ting Tu's contribution. We established the diagnosis protocol in NCKU. If the patient have the clinical presentation suggest of the EB, we performed skin biopsy and extract the genomic DNA from the peripheral blood. Whole exome sequencing helps us to identify the candidate variant. We then perform Sanger sequencing for segregation analysis. In addition, we perform immunofluorescence study and RNA studies to confirm the pathogenicity of the candidate variant. In total, we have completed the genetic study for more than 100 EB patients in Taiwan. With this cohort, we can study the correlation of the clinical manifestation, pathological findings, and the genetic characteristics. For example, we have 3 junctional EB patients with laminin B3 mutation, as labeled by the light blue color here. These 3 patients, they have the different disease severity, and we found that the severity is related to the mutation form or site and the extent of the likeness of the sprite site mutations. Next, the treatment in Taiwan. Recently, we reviewed the treatment options for EB patients. The options including gene therapy, the protein therapy, cell-based therapy, and other medications. In our cohort, there are around 20% of patients that harbors the nonsense mutation. In the past, gentamicin has been shown the read-through effect on nonsense mutation. We successfully applied the topical gentamicin ointment to induce the laminin B3, the nonsense mutation read-through, and improved the corneal erosion in the patients with junctional EB. We applied the impression cytology of the ocular surface to prove the read-through effect and the increased protein level after the ocular topical gentamicin treatment 1 week and 5 weeks. For the patients with the EB progenosa, it's caused by COS7A1 mutation, and they have a very severe itch and that they showed the very poor therapeutic response to the traditional treatment. Recently, dupilumab has been shown as an effective treatment for the patients with EB proginosa. Our patient indeed got a very good response after 3 months of the dupilumab treatment. In order to have a better understand the therapeutic mechanisms of EB proginosa, we performed the RNA sequencing study on 5 lesional skin, 5 non-lesional skin, and 4 healthy control. We found that not only the Th2 pathway are identified by the Ingenuity pathway analysis, we also identified JAK and STAT, the signaling pathways. JAK inhibitors are indeed the more effective in improving the pruritus in the EB patients, especially in the subtype of the EB proginosa. Next, we focused on the patients with the RDEB. They frequently manifested the poor nutrition, the inflammation, and also the fibrosis. We collaborated with Dr. Chen and applied the metabolomics study on 10 samples from the RDEB patients and 10 samples from the healthy controls. 7 patients that they have the severe the subtype, and the 3 patients has the intermediate subtype. We found that the metabolomics in the plasma from RDEB patients are indeed quite different to the sex and age-matched control subjects. We found that the glutamine and its metabolisms is highlighted by the metabolomics analysis. Glutamine is one of the most abundant amino acids in the peripheral blood, and it's responsible for the cell growth and proliferation, especially for the high turnover rate cells, including the gut cells and leukocytes, as well as the keratinocytes. And glutamine has been shown that it can promote the wound healing, reduce the inflammations, and lessens the oxidative stress. Therefore, we believe that the supplement of the glutamine may help the EB patients the wound healing and reduce their inflammation. So for this part, we are currently undergo the clinical trial. Next, I would like to pass it to Dr. Lee to introduce our holistic care. Thank you.